Hey guys, hello and welcome to our YouTube channel. In this video, we are going to take on the acute pancreatitis. See guys, acute pancreatitis is a condition in which there occurs the inflammation and hemorrhage within the pancreas. Okay, so acute pancreatitis is a condition in which there will happen the inflammation and hemorrhage within the pancreas. Now if we look at the basic pathogenesis of the disease, in case of acute pancreatitis, what happens over there is that there occurs the activation of the pancreatic enzymes. Okay, so there will happen the activation of the pancreatic enzymes within the pancreas itself. Okay, so there will happen the activation of pancreatic enzymes within the pancreas, and these activated enzymes will sort of digest the pancreas and they will cause the destruction of all the pancreatic tissue. Okay, so as a result of the activation of the pancreatic enzymes, there will occur the autodigestion and the destruction of pancreatic tissue. So again, acute pancreatitis is a condition in which there occurs the inflammation and hemorrhage within the pancreas, and this is entirely due to the activation of the pancreatic enzymes within the pancreas, and these activated enzymes, they will cause the autodigestion and the destruction of the tissues. Okay, so the most important enzyme in this context is the trypsin. Now what happens over there is that due to certain reasons there happens the activation of the trypsins into activated trypsin, and this activated trypsin will activate all other enzymes within the pancreas and they will cause the autodigestion of the pancreas. Okay, it will activate the other enzymes which will cause the autodigestion and the destruction of the pancreas. Okay, so this is all about the definition and the pathogenesis of the disease. So we will look at what are the causes of acute pancreatitis. Like, why does the acute pancreatitis take place? See guys, to make it clear and easy to understand, we'll have to see the conditions which can activate the enzymes. See, these conditions which will activate the enzymes which will be the causes of acute pancreatitis. So first of all, the most common condition, like most common thing which can lead to the acute pancreatitis is alcohol, excessive alcohol consumption. So as a result of the alcohol intake in excessive amounts, what happens over there is that the sphincter of Oddi, okay, you know the sphincter of Oddi, like this is the duodenum and this is the hepatopancreatic duct or the biliary pancreatic duct, and this is the ampulla, and over there we have a sphincter which is called as the sphincter of Oddi. Okay, sphincter of Oddi. So now as a result of the activation of the intake of alcohol, the tone of the sphincter of Oddi, it increases. So as a result of this, there will be an increased pressure in the ducts. Okay, so there would be an increased pressure in the ducts which will lead to the elevation or increased pressure in the pancreas. Okay, so as a result of the increased pressure in the pancreas, it will lead to the autodigestion of the pancreas due to the activation of enzymes. Okay, that is acute pancreatitis. Now let's look at the second most common condition which can lead to acute pancreatitis. Okay, so the second most common condition is the gallstones. Okay, so as the gallstones, they lodge in the pancreatic duct or the hepatopancreatic duct, as a result of this, there would be an increased pressure in the pancreas and this increased pressure in the pancreas can lead to activation of the enzymes, and as a result of the activation of the enzymes there would be acute pancreatitis. Okay, so the third, and now these are the two main conditions, and after this we have some miscellaneous conditions which are not that common as alcohol and gallstones. So these are trauma. Okay, so the abdominal trauma, I mean, these are hypercalcemias and hyperlipidemias. Okay, so these are hypercalcemias and hyperlipidemias. There are some drugs, and finally we have mumps. Mumps can also lead to acute pancreatitis. So these are the main causes which can cause the acute pancreatitis. Now let's look at the clinical features of the acute pancreatitis. Okay, so now we have the clinical features of the acute pancreatitis. The first and the foremost feature which is found in acute pancreatitis is something which is called as epigastric pain. Okay, so this is the pain which take place in the epigastric region, and the classic thing is that this epigastric pain, it radiates. Okay, so it radiates to the back. So the classic thing is that we have epigastric pain which is radiating to the back. So after the epigastric pain we have something which is called as periumbilical hemorrhage. Okay, so we have periumbilical hemorrhage, and we can also have the flank hemorrhage. Okay, so periumbilical and the flank hemorrhage. See, this is the abdomen. Let's say this is the abdomen. So we have the umbilicus. So in the periumbilical region we have the hemorrhage, plus in the flanks we have the hemorrhage. This can be due to the local destruction of the tissues due to the enzymes which are released in acute pancreatitis, and there may also be bleeding due to the destruction of the vasculature over there. So then we have nausea and vomiting. You know, abdominal discomfort can often lead to nausea and vomiting. Then we have some biochemistry behind the things. We have elevated amylase and we have elevated lipase. So these are some enzymes which are found in the pancreatic tissue, and therefore whenever the pancreas will be damaged, these enzymes will be released in the blood, that is responsible for the increased level of amylase and lipase in case of acute pancreatitis. Okay, so then we have something that is hypocalcemia. See guys, as a result of the destruction of pancreas, there is also a destruction of peripancreatic fatty tissue. Okay, see, the pancreas is surrounded by fat. So therefore, naturally, if there is happening the destruction of pancreas, see, this is the pancreas and this is the fat, the destruction of fat will also occur, and as a result of the destruction of fat, there would occur a process which is called as the saponification. Okay, so in this process, that is the saponification, what happens over there is that the calcium reacts with the necrosed fat. Okay, so the calcium reacts with the necrosed fat, and in this process the calcium, since it is consumed, so it leads to hypocalcemia. So this is all about the causes and the clinical features of the acute pancreatitis. If we look at the treatment is conservative treatment, like we have to look at the fluids and the electrolytes. Then we will have to look at the something which is called as intravenous antibiotics, so as to control the further infections of the peritoneum and something around. So this is all about the treatment. So this is all about the acute pancreatitis. I hope you like the video. For more videos like this, please to subscribe to my YouTube channel. Thank you.